Something that might not be immediately obvious about all of the proposed cuts to key federal programs by those currently in charge in Washington, D.C., is the disproportionate impact this would have on rural America and rural Kentucky in particular. That's the focus of this piece that I recently wrote for the Lexington Herald Leader. That's me, Adam. I am the communications director at KY Policy. And this is about how cuts to programs like Medicaid and SNAP, to public education and federal employment, while bad for all Kentuckians, would be particularly harmful to rural Kentuckians. This is because enrollment in these programs is higher in rural Kentucky. Look at this map here, and you can see that more than 44% of the 5th Congressional District in Eastern Kentucky is enrolled in Medicaid. The 5th District also has the state's highest SNAP enrollment. And then there are the proposed cuts to Department of Education. This map shows in the dark blue districts those that rely most heavily on the federal government for education funding. Because that money is highly targeted to the kids with greatest needs, it's most important in our high poverty districts, which again are concentrated in rural Kentucky. Now, something has to be said about why rural Kentucky relies so much on these federal programs. People in these parts of the state have generated enormous wealth, spilling their blood, sometimes giving their lives for the coal industry. And that wealth was largely extracted. It wasn't invested in building strong infrastructure or in building an economy that was diversified and that could withstand the contraction of the coal industry. So now that that has happened, jobs are scarce and unemployment and disability rates are high through no fault of the people who live in these areas. A saving grace, though, has been healthcare and food assistance and employment training provided by the federal government. The folks in rural Kentucky have had a lot extracted from their communities, a lot of wealth, a lot of resources. They don't need these vital programs ripped away from them now, too.